Beyond the lipid panel. 6 advanced tests for a deeper look at heart health. Standard medical checkups often rely on a basic lipid panel, the traditional good versus bad cholesterol breakdown. While these metrics provide a baseline, they frequently fail to capture the full picture of cardiovascular risk. In a recent discussion with Dr. Giovanni Campanile, a functional cardiologist, and Dr. Sandra Camerata, a functional psychiatrist, the founders of Corian highlighted a critical gap in conventional care. They argue that true heart health requires looking beyond basic cholesterol numbers to examine particle size, genetic predispositions, metabolic drivers, and even the psychological stressors that impact physical biology. The ApoB and ApoB/A1 ratio, while standard tests look at total LDL. Dr. Campanile emphasizes ApoB, apolipoprotein B, as the most critical marker. ApoB represents the bad particles that actively cause disease, whereas ApoA1 is the good marker that aids in clearing cholesterol. The ratio between these two is a powerful predictor of major cardiac events. For low-risk individuals, aim for an ApoB/ApoA1 ratio below 0.6. For high-risk individuals, the goal is to reach as close to 0.2 as possible, often requiring advanced treatments like PCSK9 inhibitors. Lp(a), the genetic wildcard lipoprotein A or Lp. A is a factor many people overlook because it is entirely genetic. Unlike cholesterol levels, which can be influenced by diet and exercise, your Lp(a) levels are largely predetermined. Even those with perfect lifestyles may face high risks due to this marker. Because it is a fixed genetic trait, clinicians often take a more aggressive approach to managing other risk factors when Lp(a) is elevated. Deep metabolic markers. Beyond A1C, in many clinical settings, blood sugar is monitored via A1C, a 3-month average. However, Dr. Campanile argues that A1C alone misses the nuances of insulin resistance, a primary driver of heart disease. Insulin resistance causes cholesterol particles to become smaller and denser, making them more likely to penetrate artery walls. To get a clearer picture, he recommends monitoring fasting insulin, ideally below 10 with an optimal target of 5. Fasting glucose, aiming for 7580 mg/dl. HOMA-IR, a calculation that measures how hard your body is working to manage blood sugar. Advanced lipid and inflammatory panels standard tests tell you how much cholesterol you have, but not the quality of those particles. Small, dense particles are much more dangerous than large, fluffy ones. 2 advanced approaches can provide this detail. The Boston Heart Test helps determine if you are a hyperabsorber or hyperproducer of cholesterol. The Cardio Zoomer, a cutting-edge panel that tracks ceramides, which indicate plaque stability, and myeloperoxidase, an inflammatory marker. Notably, these inflammatory markers are also linked to mental health. Higher inflammation levels often correlate with an increased risk of depression. The Clearly Scan. Seeing the pimple in the artery, many patients believe a 0 calcium score on a standard CT scan means they are in the clear. However, research shows that 15–25% of people with 0 calcium still harbor soft plaque. The Clearly Scan uses AI and contrast to differentiate between calcified plaque, relatively stable; soft plaque, less stable; inflamed soft plaque, highly dangerous. Dr. Campanile describes inflamed soft plaque as a pimple inside the artery. If it pops, it can cause a blood clot and trigger a heart attack. In-body scan. Measuring visceral fat body weight is a poor indicator of health compared to body composition. Using tools like the InBody 970, clinicians can measure visceral fat, the fat stored around internal organs. High levels of visceral fat are closely linked to dementia, heart disease, and accelerated aging, even in individuals who appear physically fit. The mind-body-heart connection, perhaps the most vital takeaway from the Corian approach, is that cardiovascular health is not purely biological. Dr. Camerata emphasizes that chronic stress driven by poor sleep, job instability, or fractured relationships leads to elevated cortisol and neurotransmitter depletion, which directly damages the heart. In fact, studies suggest that the quality of your relationships by age 50 may be a more significant predictor of longevity than your cholesterol levels. Conclusion: modern heart health requires a dual approach, utilizing advanced diagnostic technology to identify hidden risks like ApoB and soft plaque, while simultaneously addressing the lifestyle and psychological foundations, such as stress, management, and social connection, that sustain long-term vitality.